My name is Professor Ken McDonald and I'm the Medical Director of the Heart Failure Unit and the Stop Heart Failure Unit here at St. Michael's and St. Vincent's Hospital. What I'd like to do on this audio is give you a brief insight into what the StopHF service is. As the name suggests, it is there to prevent heart failure or to stop heart failure. You might ask, how did this service come about? Well, it came about because many years ago, about 20 years ago, when we started this service, we realized that the best method of treating heart failure would indeed be to prevent heart failure. At that time, however, we had a major challenge because to define those individuals most at risk for heart failure, the mechanisms were not that precise. And indeed, in looking at the mechanisms at that time, we would have ended up with a population of about 1 million at true risk for heart failure. Now that was simply an unmanageable figure. And to get around that issue, we were grateful for the development of a blood test, which many listening to this video will now be aware of. It's called the BNP blood test, or natriuretic peptide blood test. But the NP blood test measures a protein in our body, and the protein is there to help our heart and blood vessels. In all of us who have a normal heart and blood vessels, the protein is measurable at a very low level. But when it rises, it gives us an early indicator, if you'd like, an early warning system that strain is beginning to set in the heart. And these would be the individuals who are at true risk for heart failure. So now with this blood test, we were armed with the capacity to fine-tune or be more precise in defining who is at risk for heart failure. And this development allowed us to develop this StopHF research project, which tested the concept that if we use this blood test to fine-tune the risk of heart failure, we'd be more effective at preventing and slowing the development of this problem. And over the 10-year period between 2002 and 2012, this project ran with the help possibly of many of you who are listening to this audio. This project ran in this area, and thankfully we were able to prove that using this blood test helped us, in truth, define heart failure risk more precisely, but more importantly helped us to slow and indeed for some people stop the development of heart failure. And this was truly a major advance in the efforts internationally to prevent heart failure. It's important to reflect on that because not only was this important for our own community, but international communities, in particular in North America, in the US and Canada, looked at this work and adopted it as a strategy for the prevention of heart failure in their countries. Therefore, with the proof that this is now an effective way to prevent heart failure, we set about putting this into being a routine clinical service. And to their credit, the Health Service Executive, HSE, are now looking at implanting this into the routine clinical services in the country. This will be a slow effort, but again, we're looking in this particular region that since we were the originators of the idea, we've been funded to move ahead with a clinical service, and it's a clinical service that patients listening to this audio will be partaking of. What happens in the running of the service is that a general practitioner would refer in a patient to us who would have the following characteristics. The patient would need to be above the age of 40 because heart failure in general is a problem that occurs in the later middle years or in old age. And that individual would have to have one of the classical, well-described risk factors for heart failure. And they are usually high blood pressure, diabetes, or a prior heart attack. And with those characteristics, the patient comes in to the service here in St. Michael's Hospital, has some routine tests, but in particular has that blood test that I've been talking about earlier in this audio. Now, if that blood test was normal, that's very reassuring because it means that despite the individual having the characteristics that I've just mentioned, that the blood test would indicate that the risk for heart failure is very low in that individual. Now, we don't dismiss that as the ultimate and nothing more needs to be done. We will keep that patient under watchful review, but may not need to review them for every 2 or 3 years because this blood test has been that reassuring. If the blood test is, however, elevated, it does suggest that there's possibly some strain developing on the heart, and because of that, an ultrasound is done on the heart, and the ultrasound is known as an echocardiogram. It's a non-invasive test, and again, more information will be provided on that test in a different audio. But that ultrasound will help define the strain in greater detail. And if there's any strain shown, we can put in place some mechanisms and some treatments to try and keep that from developing, or potentially even regress the strain that has developed. Sometimes, despite the elevated BNP blood test, the echo may be entirely normal. Now, that doesn't mean that the blood test has been inaccurate. It just means that maybe there's something brewing, but not yet to a level that the scan will identify it. All of this information is sent back to your general practitioner, and there's ongoing communication between ourselves and the unit and your general practitioner. And that's really important because the general practitioner is the central person involved and in charge of the care of patients in the community. Over the next year or so, we hope to further evolve this service and make it more user-friendly for patients. We hope to use techniques that are called e-health techniques or digital techniques to try and provide this service in a manner which doesn't require the patient to spend as much time with us physically in the unit, but still get the benefits of the unit. And in addition, we will be providing online education, and these audios are part of this effort to allow patients to review matters in their home with their family. And in addition, we also plan to provide regular question and answer sessions, again for patients and families, to ask questions of our healthcare staff here in the unit. I hope this overview has helped you understand the service, and again, use the question and answer service that I've talked about to come back to us with any questions and indeed any suggestions that you may have to help us provide a better service. Thank you.